Another day, another story. TGC is a cell-based gene therapy developed by colon tissue gene for the treatment of osteoarthritis. While I am an AI language model and do not have personal opinions or beliefs, I can provide you with some general information on the efficacy and safety of TGC. According to the clinical trial results, TGC has demonstrated efficacy in reducing pain and improving knee function in patients with moderate to severe osteoarthritis. The safety profile of TGC also appears to be promising, as no serious adverse events related to the therapy were reported in the clinical trials. However, it's important to note that as with any experimental therapy, there are potential risks and uncertainties associated with TGC, and further studies will be needed to fully assess its safety and effectiveness. The therapy is still under investigation and has not yet received regulatory approval in many countries, including the United States. Yes, there are clinical trial reports and analyses of TGC, also known as Invossa, that have been published in scientific and medical journals. These reports include data on the safety and efficacy of the therapy in patients with knee osteoarthritis. In one randomized, double-blind, placebo-controlled phase 3 clinical trial published in the Journal of Bone and Joint Surgery, TGC was shown to significantly improve pain and function in patients with knee osteoarthritis compared to placebo. The study reported that the therapy was generally well tolerated, with few adverse events related to the treatment. In another study published in the Journal of Clinical Orthopedics and Related Research, long-term follow-up data on patients who received TGC showed sustained improvements in pain and function for up to 3 years after treatment. While these studies provide some evidence of the safety and effectiveness of TGC, it's important to note that clinical trial results can vary and further studies will be needed to fully assess the therapy's benefits and risks. It's also important to discuss any questions or concerns you may have with a qualified healthcare professional. I am an AI language model and I do not have access to individual patient reviews or personal posts about Invossa, TGC. However, it's important to keep in mind that patient experiences with a therapy can vary and that individual reviews or posts should not be the sole basis for making decisions about medical treatments. Clinical trials provide a more controlled and systematic evaluation of a therapy's safety and efficacy. The results of these studies are typically published in peer-reviewed medical journals, and can provide more reliable information about the benefits and risks of a therapy. If you are considering a specific treatment or therapy, it's important to discuss your options with a qualified healthcare professional who can provide guidance and help you make an informed decision based on your individual needs and medical history. Knee osteoarthritis is a common condition worldwide, particularly among older adults. According to the World Health Organization, WHO, osteoarthritis is one of the top 10 disabling conditions in developed countries, and knee osteoarthritis is the most common form of osteoarthritis. The global scale of treatment for knee osteoarthritis varies depending on the country and region. Treatment options can range from conservative measures such as lifestyle changes, physical therapy, and medications to more invasive procedures such as joint replacement surgery. In general, conservative measures are usually the first line of treatment for knee osteoarthritis, and may include weight management, exercise, and pain relievers such as acetaminophen or nonsteroidal anti-inflammatory drugs, NSAIDs. In some cases, intra-articular injections of corticosteroids or hyaluronic acid may also be used to alleviate symptoms. For patients with more advanced or severe osteoarthritis, surgical options such as knee arthroscopy or joint replacement surgery may be considered. These procedures are more invasive and carry higher risks, but can also provide significant relief and improve quality of life for some patients. It's important to note that the choice of treatment for knee osteoarthritis depends on the individual patient's symptoms, medical history, and preferences, and should be made in consultation with a qualified healthcare professional. I apologize, but my training data only goes up to 2021, and the available data may not be up to date or complete. Therefore, I can provide an overview of the osteoarthritis treatment and drug markets for each country, but the specific size of these markets may have changed since then and may require further research. According to a report by Research and Markets published in 2020, the osteoarthritis treatment market in South Korea was valued at approximately $128 million in 2019, and is expected to grow at a CAGR of around 6.4% from 2020 to 2027. The report notes that the market is driven by the increasing prevalence of osteoarthritis and the growing demand for non-invasive treatment options. In Japan, the osteoarthritis treatment market was valued at around $190 million in 2018, according to a report by Transparency Market Research. The report notes that the market is expected to grow at a CAGR of around 5.3% from 2018 to 2026, driven by the increasing prevalence of osteoarthritis and the availability of advanced treatment options. The osteoarthritis drug market in the United States was valued at approximately $6.6 billion in 2020, according to a report by Grandview Research. The report notes that the market is expected to grow at a CAGR of around 7.8% from 2021 to 2028, driven by factors such as the aging population, increasing prevalence of osteoarthritis, and the development of new and more effective drugs. In China, the osteoarthritis treatment market was valued at around $750 million in 2019, according to a report by Research and Markets. The report notes that the market is expected to grow at a CAGR of around 9.6% from 2020 to 2027, driven by factors such as the increasing prevalence of osteoarthritis and the growing demand for non-invasive treatment options. It's important to note that the sizes of these markets may vary depending on the specific sources and methods used to estimate them, and may have changed since the data was last updated.